approval of the agenda. Is there a motion to approve?
So moved.
I'll make,
Director Elliott, is there a second?
I'll second.
Second by Director Parks. All in favor?
Aye.
Any opposed? Passes. Next, we'll do the flag salute by Director Clark and followed by the invocation by Director Elcott.
Oh, please stand. Right hand over your heart. Pledge. Begin. Pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
You'll remain standing with me, please. Lord, I just want to come before you and praise you for all the times that the board members here get together and that we are equally minded, and when we're not, we're able to express why we're not, Lord, and I think it makes us a better board. I want to thank all the employees and all the employees, those in the kitchen, those in housekeeping, and that they just continue to do the work that they're doing. And I would like to put forward just the blessings this hospital has had, even though we've been up and down with grants and no grants, and as tough as that is, that we're still sticking to what we need to do. I just ask all these things. Amen. Can somebody give me some wheels?
That's Jan.
Yeah, there's a cart right over here. The mission statement is on the agenda for those that want to read it. Item C is the public comment portion of the meeting. Is there any public comment today? Twice. Okay. Item D is the consent agenda. These are routine and non-controversial items. Unless somebody wants to.
I would like to talk about something on 17.
Item 17, you want to pull that? We'll put that as item 4 under new business, Director Parks. That works.
Thank you.
Is there anything else that needs to be pulled? Once, twice. Okay.
Motion as such with the changes presented.
Okay, there's a motion by Director Clark to approve the consent agenda minus item 17. Is there a second?
I'll second.
Second by Director Elcott. Any other discussion or input? Okay, hearing none, all those in favor?
Aye.
Aye.
Any opposed? Okay, motion passes. This time we'll turn it over to the Chief Nursing Officer report. Ms. Shannon, turn it over to you, ma'am.
It's been busy moving along, getting the logistics of starting the RN residency program. A lot of the new grads graduate this month. I think their review ceremony is actually tonight. We got really lucky this year with Bakersfield College. We have a paramedic who loves this hospital who's been tooting our horn. So we get a lot of applicants from that. So it's
That's
wonderful.
great.
Hopefully that will just keep continuing. We can build that relationship with PC2 to be there for their job fairs. The next finance or one of these, I think the end of the month. Okay, the end of the month, you'll see the proposals for the mannequins. So we teach the ACLS PALS, and that will also be able to do mock codes and also training for the RN residency program. So we'll be able to use them for all of that. Started our DAISY nomination program during Nurses Week last week, and it's been going up like gangbusters.
Oh,
Lots of patients have been saying wonderful things about the nurses and turning in their little slips. And the community also was extremely supportive of Nurses Week this year. They donated all sorts of things for us to do a drawing to be able to give out to the nurses. So it's been a really positive week of things.
Let's get into it. Are there any questions for Shannon?
Sorry.
Okay, go ahead.
I just had a comment.
Yeah.
I'd seen a letter you posted on Facebook for nurses week in appreciation of. Nice. It was
It
good.
was very nice. Yeah.
You did good. Your team did good.
Yeah.
It was well done.
The nurses really appreciate it. That was a good meeting. Good
Yeah,
job.
wasn't.
Thank you.
My son was in there sometime last month or a couple weeks ago, and he couldn't say enough good about it. It was the doctor. I tried to find out the doctor's name because we must have one good one.
We have more than one.
But everything about it, he couldn't say enough.
That's great.
Thank you.
Any other questions, comments? All right, thank you, Shannon. for the report. Thank you. Next, we'll turn it over to the Chief Executive Officer report, Mr. Leverage.
Thank you. I just wanted to add to what Shannon said about the Nurses Week and Hospital Week. The reason we got those donations because Shannon went around to every business and asked them. And that's something we've never probably done before, haven't done in a while at least, but got about $4,000 worth of donations to help with this whole thing.
From the business side of it, we like to get it. Now, she didn't come by mom's because I wasn't there.
I could.
We
You can
like,
still donate if you want to.
we like to
Next year.
we like helping.
Right, thank you.
If nobody asks, we don't know that.
You're right, you're right.
So it's a really good thing, and it's not something to feel bad about going around and asking, because the community likes doing it.
Thank you. So we appreciate it. Yep, it
Oh,
really helped with it.
Okay.
And then also, I want to give special recognition to the Employment Engagement Committee chaired by Nick. I want to call out Amber Shear, Julie Inman, and Hannah Register, who really did a good job in all the planning and all that stuff. And it was, the employees, I think, really loved it, and it was a good, really good week. We're still in the middle of hospital week, I believe, but it's going really very well, and I think it's good. Thanks. Since we talked last, we've had a couple of surveys. One was the SNF survey, and our medication error rate was 0, which is great. And they found a few minor things. One guy didn't have a beard net when he was doing food. Food was brought from home was not properly stored. Hand hygiene, oxygen orders. The med cart wasn't locked. RN coverage, we didn't have 8 hours a day, every day of RN coverage, but they let us slide on that, I believe. Right? Yeah, because we were trying. We don't have the nurses to be able to fill that, but we are trying to get that. And we will. We have got a lot of nurses coming. Shannon is taking some of them from Ridgecrest, and they're going to be coming. So we will. We'll take them. Another thing was housekeeping chemicals were not secured properly, and there's no barriers. A lighter was not properly stored, and we need a policy procedure for residents who smoke. We've got one resident who smokes now. She grandfathered in. So Shannon developed a policy for that, I believe, already. No. Oh, Sally, I'm sorry, Sally. Overall, it was a very good survey. Plan of corrections will be submitted, was submitted already. Then we had a SNP life safety survey, which goes to Bob. And there are very minor things there. 2 doors failed to latch properly. They were fixed before the surveyors left. Improper use of extension cords and adapters. We had a couple of extension cords, and we are training our people not to do that anymore. And that's already taken place, I believe. Emergency preparedness plan needs updated, and it's related to some of the admin contracts. Plan of correction has been submitted. They sent it back a couple of times. We were working with them right now to get it fixed.
Everything's accepted except the training of the SNF staff on extension cords.
I have to provide this on next sheet, but that is not.
Right. Next week, and we'll have that done next week. But both surveys went very well. The staff did a great job, and we're very happy about it. So we're good for another couple of years now, which is great.
One more year.
Whoa, one more year.
That one's annual.
Oh, that was the end. I'm sorry. Yeah. Okay.
Here's every 3 years.
Physician recruitment. We have a new nurse practitioner starting in the clinic. Yes, very, very good news. So we'll be able to start accepting new patients, I think, which is great. We had Dr. Petty had a site visit on April 13. She was extended an offer. We are still waiting to hear back. She's got a couple other people looking for her, and we'll see. I think
Can we ask Greg if we are we taking new patients?
as soon as this person starts, we will.
Miranda said we would be open. to
We will. Is
negotiate.
Greg there? Yeah, Greg's there. Greg, you can talk on that, please.
Yeah, as soon as we have approval for med staff privileges, we can get her started. And when we get her up and going, then we'll work with Nick and work on some marketing. And she's very enthusiastic, has strong ties to Kern County. She's not someone that's really going to be going anywhere. So she's going to be great. And then we have 2 other physicians that are coming up for on-site interviews. One will be here tomorrow, and another one, I'm not sure the exact date. It'll be within the next couple of weeks. So really good prospects right now.
Thank you so much.
Things are looking up there as we can
Good,
start.
yeah.
We, that's a big part of our hospital because not only is it clinic visits that we get paid for, you get the ancillaries also. So by not having any new patients, it's hurting us our revenue wise and really profitability wise too. Sure. So that's good. We had a managers meeting. We're kind of changing some of the managers meetings. The next meeting, we're going to have everybody give us some input on how we can improve morale around here. I think it's starting to go up already, but we really want to get everybody's input on how we can do it even more. They are on the floor working with these people closely, and they know what's driving them a little bit better than we do probably. So that's what we're going to talk about next time. Our revenue cycle, we've been working a lot on that. We are trying to improve the CPSI and RCM system. We've had when you put something in to get fixed, it's called a situation. We have had 18 situations so far and 10 have been answered. So we're trying to make it so the revenue cycle is a lot less manual and a lot more using the system. We've been kind of going around the system so far because it really was not implemented properly. We're discovering that and we're going to fix it though. So I think we're leaving some money on the table. That'll fix that. I met with the CEO from Bakersfield Memorial and Good Sam to try to grease the wheels on some transfers, and hopefully that's going to help. They said they would do, but of course they're going to say that, but we'll see if it really comes. But that's one of our big problems in the ER. We need to be able to transfer patients out when necessary. And the lady from Good Sam said they were able to take some of our mental health patients that we want to transfer out, and we have really trouble transferring those people out. But that'll be helpful. Ross, I think you asked about the Ridgecrest district. I don't know if you got answers yet.
Well, we've got actually an item on the agenda
That's
for
on the
discussion.
Oh, okay, so I'll wait then.
Yeah, but I did have questions about
I've got some answers.
the hazard mitigation plan,
I have them. You want to talk about that now?
if that's okay with you.
Fine with me. You asked, you wanted to, when did we originally, the mitigation plan expired on December 31st, 2025. Our original submission was in 2019 under the previous county multi-hazard mitigation plan. The FEMA BRIC grant was submitted in 2022 and then reviewed through 2024. In April 25, it was canceled by the federal government. And in mid 2025, we filed for the second Cal OES FEMA grant. Right now, we're counties at the time of the filing for the second grant, the county's hazard mitigation plan was still.
That's good. So I think we should be able to make the argument to FEMA or whoever is setting these rules that at the time of application, the county's mitigation plan is still valid. The fact that they've dragged their feet, DOJ has stole the money from FEMA. There's all kinds of reasons that we can come up with why we haven't gotten the award yet. And yet, now that our plan has expired, we don't qualify.
That's what they're saying.
Well, what they asked for was a letter as to why they had not filed on time and when they would be filing. So he has all that.
I have a copy of the letter too.
Okay.
Basically what they're saying is they don't have enough staff. They're a bit too busy to do it, which is not a good excuse.
Yeah, it's not a real good excuse, but they didn't take my suggestion of using the fires.
Yeah.
And so anyway, so the letter has been accepted by Cal OES and is being forwarded to FEMA saying that there was a hardship. So therefore they will have their study done and it'll be in by such and such a date. And so, please go ahead and issue the grants based upon the plan is in the works. Okay. And it's not a complete new plan. It's just an update.
It's an update.
Yes.
So if our application gets kicked out because of that, I think we need to get our 2 senators and our congressman involved with the fact that at the time we submitted this application 5 years ago, everything was fine. You people drug your feet not us. We got everything done on time, and now you're holding us accountable because you people screwed up the system?
One person dropped the ball and.
Yeah,
Well, it's more like a punishment in some ways, I feel like, you know.
I think we need that requirement waived.
It's every grant in the whole county too. It's not just us.
Yeah.
Because there's other grants that they have applied.
Okay.
The fact that they're saying they don't have the staff, is that a legit, why don't they have the staff? Who's,
They had some people retire and various things, and it took them. They're just having some issues at the county, and as far as getting replacement people in, took longer than expected. It took longer for them to get the contract signed with the consultant who's doing the update. And so there's just a number of factors that just caused the process to get drug out.
but that's not a legitimate reason as far as they're concerned. Can we put
Well,
that down?
we don't know. I mean, we don't even know when FEMA might review it because FEMA is still not budget. They still haven't been budgeted. Federal government has not passed budget for FEMA, so FEMA's not at work. So we don't even know when FEMA's gonna be at work because they've sent everybody home, most everybody home, because there's federal government can't pass a budget that funds FEMA. So everything's up in the air.
So the supervisor is the one that would ultimately be held responsible for not having,
Well, it's the people who will not vote through a budget, federal government,
no, I'm talking about our.
These are already counted.
Oh,
as far as.
I don't know, supervisors. They really were advocating on our behalf. That's when we went to that meeting where they submitted the application on our behalf. So it's really not their fault.
Yeah.
It's the people who work there.
Anyway, I don't want to accept the fact that our plan's expired and that's why they're going to deny the grant. I want to push that if it comes to that.
If it
Can we
comes
get
down to
letters
it.
now from those people saying, hey, you know, this is the way it should be? And send that in with. the
I'm
letter?
thinking,
Is it too early to get the letters from them?
Well, let's wait.
I'm thinking we need to go political.
Yeah.
Get the senators and the congressmen involved saying, hey, FEMA, waive this. And here's why.
Well, we met with our representative and nowhere. You
Call his wife.
Yeah.
Yes,
Yeah, but that was a while back and
understood.
we were on the cusp of
But
actually getting
he
the
didn't
grant.
do anything.
I know.
He listened for 30 seconds and shut me out.
Shut up. I know.
So,
Right.
Well, perhaps maybe at the building and planning meeting, we could do like a joint statement on behalf of the board
All
to,
right, that's a good idea.
if that might be a good idea.
We can do it. I mean,
Is that-
we haven't been denied yet.
And we could.
It doesn't hurt to at least try to.
Right, get
Yeah.
be proactive about it.
Yeah.
We could
Is that-
like deliver
okay.
and send it to Vince and have
Right.
him send it back to us.
Yeah, that's fine. I agree with you. That's it for my report. Any questions?
Any questions for John?
Do we have grounds to sue? Because of all the
Yeah, tell us.
chaos in the federal level?
So probably not at the federal level, because it's discretionary on there. If the grant is not an entitlement, and so probably not on the federal level. Do you on the county level? That is more of a gray area. And the reason why isn't because, they're justified in failing to submit it, but because it was contingent in the first place. It was contingent upon the feds approving the grant, which was within their discretion.
Okay.
So John and I have talked about that a little bit, and we can see how it plays out, but it's not a clear case one way or the other.
Okay.
Do we really want to sue the county?
Well, not really,
Right.
but I'd rather sue the county and have the hospital built.
We would rather have their money than us.
and I went down the road of, the reason the county has to submit for us is we are not in the hazard mitigation plan. And that's because Kern County for 20 years has not considered ever putting any of the hospitals on the hazard mitigation plan. And so I went to meetings and on how to get on to the hazard mitigation plan. I mean, it's still one that's not approved yet, but it would require us to hire a consultant. And I put together a hazard mitigation plan for the entire Kern River Valley That would then be sent to FEMA and it had to be approved by FEMA. They says it usually takes 3 go-arounds to get it approved by FEMA. Once FEMA has approved Kern Valley's hazard mitigation plan, then we could be accepted to be in Kern County's hazard mitigation as one of the listed entities. At which point then the county wouldn't have to file for us, but we still wouldn't be able to file right now because the county has not gotten the plan in. Okay. All right. So I didn't figure it was worth probably spending $100,000.
Not right now.
And hundreds of hours of time.
Right.
To be listed on a plan that they haven't gotten done.
Yeah, I agree.
Any
Thank
other-
you.
Any other questions or comments? Sir.
We're gonna have a chance to talk to Bob later.
I'm sorry.
We'll have a chance to talk to Bob later about different stuff as it comes up.
Sure, next meeting.
I was just thinking about something. He's so busy, that would help him. I think I saw it was on TV. They had a ponytail already combed. The girl just put behind her head. And if we could get him one of those.
There you go. Works for me.
Okay.
I don't think that was on the agenda.
Yeah, I was just gonna
talk about
We'll
that.
put it on next month's.
Yeah.
Add to building and planning.
Yeah. Okay, moving on. Thanks, John. Under new business, we have a CR request, Mr. Zuber.
Yeah, this came up in finance from HIM, and so I need to get a little bit more information on this. The question in finance that I proposed was, I didn't know why the quote was 2 years old that had been submitted. I found out that the company is going to honor that 2-year quote, even though it's 2 years old. So that's one of the questions. The other question was, I needed to verify that the claim that parts were unavailable was true. So I did, and parts are actually unavailable with license breaking all the time. So that's the information I didn't have in finance, but
As I had made the statement, for them honoring that price is a great thing, because
Yeah.
I've seen that same unit at double that number.
yeah, I'm surprised. So we'll see, hopefully, when it actually comes down to sign the thing, if that's what they still do, but that's what,
Make the motion to accept it. It's definitely needed.
Motion by Director Clark. Is there a second?
Second.
Second by Director Parks. Is there any other discussion, questions, or comments on the CER?
Nope.
From the public, okay. Hearing none, all those in favor?
I,
Any opposed? Okay, passes. Item 2 under new business is the East Kern Healthcare District expansion to annex the Ridgecrest Hospital. So I'll turn it over to Ross because he's had some concerns about this particular issue. So,
thanks, John.
uh-huh.
So East Kern Healthcare District, I don't think they don't have a hospital. They're basically in California City. I don't exactly know all their boundaries. It may include Boron. But they're a healthcare district like us. Last year, they got approval from the Local Agency Formation Commission, LAFCO, to expand their boundaries to include Ridgecrest. The proposal there is essentially to include the Ridgecrest Regional Hospital as part of their district. So conceivably, Ridgecrest Regional Hospital, I think there's a lot that would have to happen to make this actually a reality, but the concept of this was basically converted to a public district hospital, so that they would then be eligible for intergovernmental transfer money.
But Ross, they changed their mind for now. That's the information I'm getting from DHLF and also from the Kern Valley Sun.
We'll get there.
Okay, go ahead.
I still want the board to take a position of opposition to this because they may change their mind. So let me finish.
Okay, didn't mean to interrupt.
So the IGT money is a finite amount of money. Right now, we get the allocation for rural hospitals, 100% of that allocation. If Ridgecrest Regional becomes a public facility, then we'd have to split it with them. So we would lose 50% of our IGT money.
That's not true.
It's not.
No.
So there's a formula.
The only program that would affect is rate range, and that's coming from Kern Health Systems, and they have very little presence out there. So it'd be a very little effect on us.
Okay. Well, Maybe it's not a problem.
It could be.
I haven't-
As of right now, it's
I
not.
haven't seen the facts.
Yeah, that I spoke with DHLF, like I said again, and even if they did get, and the fact that they could become a district hospital is still up in the air too. The way they went about it, Scott and I were talking about, so the way they went about it may not even be legal. So that's still up in the air too. But even if they do become a district hospital, their effect on us would be minimal.
Okay. I guess my request to you and to make a formal referral to you, if the board will approve it, is to definitively figure out what kind of impact that will have on us if they become a public hospital.
And I started working on that already.
Okay,
Yeah.
all right. So, you know, it's not real time sensitive because I don't think this is going to happen next week.
I don't either.
But in the next couple months, so my request to John and to the board is, I want to make a motion for a formal referral to have John investigate this and basically come back and identify what the impacts are going to be to our district if it were to take
You
place.
need a motion to do
So,
that.
so it's a discussion item today,
Yeah,
but, you can still do a referral, right, Scott? Not just as a formal motion or,
I have a question.
okay, go ahead.
So are they is California City trying to push this, or is Ridgecrest Hospital pushing to bring?
I think it's Ridgecrest.
Because Cal City's a whole lot closer to Lancaster Hospital than it is to Ridgecrest.
It's not East Kern Healthcare District, it's Ridgecrest.
Yeah, okay.
Because East Kern does not have, they have medical office buildings.
Right.
They don't have a hospital.
Yes.
So because of that, Ridgecrest viewed them as a natural ally in the process.
Okay,
And they want to wait to see what happens with the big beautiful bill before because it could hurt them.
right.
I mean, they don't want to do this and then all of a sudden they get less money.
Exactly,
So that's what they want to wait for.
exactly.
And that, the effects of that will be.
But if it impacts us, my plea to this board is if it impacts us and we'll wait for your analysis and your numbers, we need to be standing up and saying, hell no.
Agreed.
Hey, East Kern Health District, you're gonna hurt us. And we need to tell them, let them know this is gonna impact us negatively, if in fact it will.
Right.
Is the board okay with, a referral to Mr. Leverage to do that analysis?
Yes.
Okay. You got unanimous support, Ross.
All right.
Okay, thanks.
We get to vote on this.
It's just discussion today, but we can do.
No, but for the referral, my motion is for the referral to John.
Can we, you know, it's a discussion item or Scott or?
That's why I asked it to be
It's
placed on the
under-
agenda.
It's
so that
under
the
new
board can vote.
business, so you can take action on it.
Okay.
Okay, then you made the motion.
All right.
Okay, I'll
Just a
second.
second, okay. All right. Any other discussion or input from the public or staff? Okay, all those in favor?
Aye.
Any opposed? Okay.
Thank you
motion
all.
Passes.
Appreciate it.
Sorry for the confusion with the,
Now, since you did that, can I make a motion that we give him more time? Because we're going this calendar up.
No, I've already started. I mean, I'm already working with the district. I'm in the DHLF on that. But they're on top of things. Actually, the guy who gave me the information first was John Watkins from
Oh,
Newspaper.
I'll be darned.
He's on top of things now, the scoop.
Great, awesome.
inside information.
Yeah, exactly. He's friends with the CEO at Ridgecrest. That's why.
Okay.
Damn independent connection.
Next, we'll move on to item 3, senior management compensation. Director Parks asked for this to be put on the agenda today.
Okay, what, I get confused easily.
Okay.
And back in April, I think everyone was supposed to be raising. Is that correct? When you had told me that I would be able to question some of the activities. And I've seen nothing that I could question or nothing presented that was as a raise. I just want to know,
I presented to you the senior, the C-suite salary. But we're still working on the other ones, the ranges on them. If we have a meeting scheduled next week for that. We'll be able to present the rate ranges for you for discussion.
are people, did they get their raises on time?
They got their original raises, but they had to get these other races. That's what we're working on right now.
Okay,
No one's got,
Continue to get their annual merit increases if it's their evaluation time. That hasn't stopped.
that's not on
That's still
their
going.
anniversary date, but we're
okay,
still.
so the C-suite ranges,
Yeah,
it was, nothing's done. Okay.
No, I
Okay,
gave you the
you'll give
information.
me a chance. If you do make a decision, you want to do something that at least me as one board member will have the opportunity to question what's going
Of
on.
course.
Okay.
So,
The whole board, actually.
yeah, under relatively recent California law, the district should post its salary range or its compensation range for every position, the job description, and you can do it on the website. And so that should all have board approval anyway. So you should, when the staff comes with their recommendation, that comes to the board for approval.
But when they come for the approval, I would like it to be in time to be able to ask questions about it.
No
We
problem.
don't want to have it to where 3 months ago we did this, we need to approve
No,
it now.
no, we're working on the rate range, just need a little massaging on the ranges because so
Right.
what we do is we use the HASC survey information, but it's difficult to apply that to us because we're so unique. And that's what we're trying to massage these ranges right
We
now.
have a pharmacy, a clinic, a hospital, and a skilled nursing. So we're 4 different things. You're right. I'm agreeing.
Right.
Okay, okay,
We'll,
so you.
by next board meeting, we will have it done.
Thank you.
Any questions or comments on this?
None.
Okay, thanks, Gene. And then item 4 was the item that Director Parks pulled, the CIO report. Mr. Zuber.
What page was that?
I guess I should look at it too.
The artificial intelligence,
Yes, sir.
the Microsoft giving us a 60% discount to participate in that program that you referred.
What that program is their Dragon Copilot product, which we do not have licensing for yet. But before we got licensing, the process of bringing us these discounts through, oh goodness, did I put it in the name of this? It's a grant name that we already have to get cheaper licensing through Microsoft. It's the same grant.
Okay, so it'll be,
Uh,
it'll be 60% less of what? I mean,
Oh, I think it was about $800 per month. It's what the going rate is per license. So it'd be 60% of that. Which would be close to on par what we're paying, be a little bit more, but close to on par what we're paying for our medical dictation licenses that we already have.
sounds like it would be something that's going to benefit us.
If we decide to go that route and implement, then absolutely we benefit.
Okay, that was my only question.
We're also using some AI in the revenue cycle. Our consultants are using some of that to analyze some of the claims too. We're
Cool.
starting to use it
Oh.
finally done.
Yeah, no, it's, we're gonna get ready. Thank you.
Okay, thanks, Carrie. Is there any other questions for Carrie on the CIO report?
I have none.
Is there a motion to receive and file this report? Motion is second. Director Clark, is there a second? Second. Second by Director Elliott. Any other discussion or input? And all those in favor?
Aye.
Any opposed? Okay, passes. We're already at director's comments. This is kind of a short, open meeting so far. Who knows how a closed session? We'll start with Director Elliott. Anything?
Thanks.
Uh-huh.
So I want to announce I'm not going to be seeking re-election this year to this board. So the filing time for that is coming up in July, and I wanted to give community members the opportunity to get their ducks in a row if they want to end up being on the ballot for November, because my name won't be on.
Did we say something wrong or something?
No, not at all. I've enjoyed this time, and I'm not resigning today or anything. I'll continue to, fill out the rest of my term until the end of the year. But we've accomplished a lot together. We have. We've maintained a hospital and an emergency department for this community. You know, those are always optional. And we've made the commitment to make that happen, and everybody is rowing in the right direction. And so it's a wonderful thing. We as a group and with all our team members have maintained the financial viability of this facility. We've managed the whole facility through the pandemic, which is no small feat. With what we've spent now, our facility is really, for the most part, self-sufficient during a disaster. We've got the electrical capacity. We're working on the water capacity. We've got the sewage capacity. All the things that we've been doing for the last several years has positioned this facility to stand alone during a disaster. We have a new pharmacy. Both, the pharmacy internal isn't new, but by golly, its air handling system is. And of course, we're seeking grants for the reconstruction, which hopefully that will happen. We've got some challenges ahead of us with the results of the Medicaid cuts at the national level. We don't yet know how hard that's going to hit us, but we have a pretty good sense it's going to hit us. And I want to make room for somebody who's got the fresh ideas and energy to tackle that. So I'm going to step aside and let some other member of the community take that on. So I want to thank everybody. What a wonderful organization this is. I'm not resigning, not because I don't love the place. It's just I want to make some room for somebody else with some fresh ideas, because I don't think I'm the right person for that. And my time with my family needs to take a priority. So thank you all.
Understood. Dr. Elconin, any comments today?
Well, first of all, for Ross, you fill a big spot here. You're always making sure everything's spelled right. Make sure, I think it's missing a comma. So you're always right on top of that, but you bring information from other facilities that you have, with Kern County or with Kern Health Systems. It's Kern something. And so that will be missed. So, but thank you for the time you have. So
Pleasure. Thank you.
that's it.
That's it.
Yeah, I can only do so many times.
Director Parks?
It pains me to say that you have been probably the best board member here, even maybe as good as me. But you have been awesome helping. 7.5 years ago, when you first got on, we were talking about the pharmacy being on this end of the building that is currently in now. And we worked toward that. And finally, you got it on that wrong end. But thank you for keeping me in mind. You're an awesome board member.
Director Clark?
How do I top?
It doesn't have to be about me.
The fact of the matter is the knowledge and the skill set that you brought to this board benefited all of us, including the facility. I don't think there's anyone above myself who can say thank you for that. And everyone else, thank you for being here.
I really can't say anything else, Ross. Everybody else already said it. But no, I also thank you for your service on the board, and also being on Kern Health Systems, making sure our hospital wasn't left out of some of that money. I know you've worked very hard the last several years and through the pandemic and everything else. And And so I thank you for your service as well. I also want to say here that Ross is going to be receiving the Book of Golden Deeds from the Kern Valley Exchange Club, which is the club's highest honor. So it's not only for his work here on the hospital board, but he's done a lot of other work out in the community, volunteering soccer coach. He served on the school board for a lot of years. He helped Kathy Maloof with the dog park. I mean, just a handful of things that we've done over the last 35 plus years. So it's really appreciated. And thank you all for coming here as well. This sounds like it's been really good news this last month with finding the physicians and hospital awareness week.
Nurses Week in Hospital.
Okay, thank you for the correction. Sorry about that.
Next week's EMS week.
Yeah.
Yeah.
And the opening of the new pharmacy. There's just a lot of really positive things going on here.
It's been going, yeah.
That's- So anyway, thank you all for coming. And with that, we're going to adjourn to closed session at 2:41.
Thank you.
Thank you.
Quick meeting, John.
I know.
Man, it's a record, I think. So far, yeah.
Nick, we're sorry we missed you at lunch. We were able to see a whole bunch of exchange rights that never come.
Since I'm in.
It was all the schools today.
Oh, really? I was scared you guys were just gonna roll me.
Trust